Stop playing phone tag with your doctor. Check out your lab results online, ask questions, become a more active patient. That's the promise behind MyChart. That's the story in this month's Code View. In mid-September, Cone Health launches MyChart. Go to conehealth.com, log into the secure portal, and you can look at test results, find information about your diagnosis, even ask your doctor questions. Dr. Stacy Blythe of LeBauer Healthcare has been using MyChart as part of a pilot project. One of her patients is Cone Health Executive Vice President and Chief Medical Officer, Dr. Mary Jo Cagle. They took a moment to talk about MyChart from each of their viewpoints.
What MyChart does is allow us to interact with a doctor's office on our schedule.
It's a way of kind of having a more seamless relationship with your patients at times when you have a moment in the day, as opposed to that kind of phone tag thing. So once we get used to it, once patients get comfortable with using it, I think it will make for more seamless communication with patients when you have that free second.
MyChart makes it easier for the physician to make it clear what they want from the patient, and for the patient to have that conversation in black and white in front of them.
Stacy and I talked about things like diet and exercise, and so she put on there my plan and what she recommended for me for my diet and exercise. So I can't use the excuse that I couldn't remember, right? It's right there in black and white. So.
And you get that a lot with patients too. I remember as a younger doctor inheriting older patients, and they just would swear to me they'd never been told, they didn't know that they had renal trouble or diabetes even. No, I'm not diabetic. Well, why are you on metformin and glipizide or something? And for them, if it was controlled, they didn't have it. And so this kind of permanent kind of, here's your lab work, here's my statement about that lab work, they can go back and say, oh, I guess I was told.
Most of us communicate with our doctor's offices over the phone. With MyChart, you send a message over the secure portal. A nurse triages the questions, and either she or the doctor answers them, usually within a day.
What MyChart allows us to do is get that information on our schedule and not have to annoy the nurses by playing phone tag all day long.
It's not annoying. But
well,
that's our job. But no, I understand that.
But you know, we do.
Blythe says MyChart saves time for patients and nurses and keeps her off of the phone. To log into the secure web portal, you'll need an account. You can get one at the upcoming Cone Health Benefit Fair.
We will ask every employee for permission to look at their medical record to get them into the MyChart sign-up screen. If they choose not to do that for privacy reasons, we will print off a letter for them that will have enrollment instructions, as well as an activation code that they will need, and they'll go home and they'll log into a website, use the activation code on the bottom of their letter, and it'll be a 5-minute process.
If you don't have time at the benefit fair, pick up instructions and a code so you can sign up from home. Ford points out that once you start using it, you'll be better able to encourage patients to sign up and use MyChart to better manage their health care. Finally, don't forget to take a few moments to go online and take the annual Employee Partnership Survey. You should have received an email from Press Ganey Survey with instructions and your unique PIN number. Not only is your opinion important, but it's listened to.
There's a lot of scrutiny. I know all of our Leadership Council members, and particularly our campus and division leaders, look very closely at what they can do to be better, and they really are committed to providing the best workplace for our employees that's possible so that we can give exceptional care to patients and families.
Hey, don't wait. Take that annual Employee Partnership Survey right now. It closes September 10th. That's it for this edition of Code View. I'm Doug Allred, and I'll see you next time.